Hello there, my name is Hunter Murdock. I am an economics student at the Hunstman School of Business and a Center for Growth and Opportunity undergraduate research fellow. I have been working with Colton Dewar, a fellow student and undergraduate research fellow, and with Brian Isom, a research manager for the Center for Growth and Opportunity. The title of our paper is Expanding Healthcare to Underserved Communities. For many years now, I have had lower back problems due to a herniated disc. For the most part, my symptoms are manageable, but every once in a while, my pain flares up to the point that I can barely stand for nearly a month. The last time that this happened, nearly 18 months ago, at the insistence of my wife, I made an appointment with our primary care doctor. However, due to demands on his time from his other patients, by the time I was actually able to get in and see my doctor, it was only to have him tell me that there was nothing that he could do for me. By that point, I was practically better. But it was only after 3 weeks of pain. He then went on to tell me that the next time that this happens, I should try to get in to see him sooner, because then he might actually be able to help me. While my example is somewhat trivial, it highlights a much bigger problem for many Americans. Access to healthcare is a key factor in health outcomes in the United States. Access to primary care, which is the process of promoting and maintaining health in patients, helps to diagnose problems before they become serious, leading to a reduction in hospitalizations and other negative health outcomes. Our study is an analysis of the existing literature on the subject of access to healthcare. Some of the largest underserved populations in our country include rural populations, which make up 1/5 of all Americans, Native Americans, and linguistic minorities, or those who do not speak English as their first language. Most policy suggestions today focus on healthcare insurance, which is an important aspect of the problem, but does not solve the problem of provider shortages. An area is defined as having a healthcare provider shortage if the population to physician or other provider ratio is greater than 3,500 to 1. Figure 1 shows that in almost every county in the US, there is at least one area that has provider shortages, with many counties, those in dark blue, having the entire county as a shortage area. We find significant evidence that policymakers have a key opportunity to increase access to care by removing barriers that prevent existing providers from serving those who need them. Our analysis found that there are several areas that policymakers can focus on to improve access to care. The first is telehealth. Telehealth, or telemedicine, is the use of technology to provide healthcare services remotely. The coronavirus pandemic has provided a great example of why this is so valuable when so few people want to go out to receive these routine services. Many routine healthcare services can be provided over technology. And it has been shown that telehealth is safe, effective, and cost-reducing by groups such as the Mayo Clinic. But these benefits are decreased in most states by the inability of physicians to treat, even virtually, patients who live outside of the state in which they are licensed. This is a huge issue when you consider that 1 in 5 Americans live in rural areas, where travel to see a physician may be costly. These needs could be met by physicians and providers from across the country, but they are not able to meet those needs virtually because of restrictions on telehealth. Scope of practice restrictions similarly limit the effectiveness of providers such as nurse practitioners and physician's assistants. Nurse practitioners and physician's assistants are fully trained and fully qualified to provide all basic routine preventative care and are often trained to deal with more complex issues. Scope of practice restrictions restrict their ability to practice independently of an MD, diagnose patients and order testing, and to prescribe controlled medications. These requirements make care more expensive and reduce total access to care, while research shows that these restrictions do nothing to improve quality of care or patient outcomes. Solutions such as telehealth and allowing full scope of practice for nurse practitioners and physician's assistants can increase access to care without worsening the average health outcome for patients. Thank you.